EpiFaith CV is designed for central venous catheterization. Unlike traditional syringes, it offers a more refined design with essential features like an automatic aspiration plunger, guide wire insertion hole, and a pressure indicator. These enhancements simplify the procedure and provide real-time visual feedback for quickly identifying accidental artery punctures. The initial step is to connect EpiFaith CV to a puncture needle. Then, push the blue plunger forward to remove all air from the device. Insert the needle into the tissue. Next, press the trigger area to activate auto aspiration. Please note, do not lift the trigger area, as it won't activate auto aspiration and could damage the device. Initiate the needle localization process by gently advancing the needle toward the vessel. The device's auto aspiration system eliminates the need for manually pulling the plunger while inserting the needle. As soon as the needle enters a blood vessel, the auto aspiration system causes blood to come into the syringe. If the pressure exceeds 30 mm of mercury, the guide wire insertion hole protrudes and reaches its maximum at 50 mm of mercury. Hence, users can promptly identify an arterial puncture. Conversely, if the insertion into a vein is successful, the insertion hole will not extend beyond the plunger even as the blood enters the syringe. Before inserting a guide wire through the insertion hole, it is recommended to press the trigger area again. Double-checking the vessel pressure ensures the needle tip remains securely within the vein, preventing any inadvertent slippage. Next, insert the guide wire through the guide wire insertion hole, safely completing the subsequent catheter placement process. Tips to optimizing procedure performance. Use with a catheter over the needle. The use of a catheter over the needle is similar to a standard puncture needle. However, after inserting the catheter, it's important to reconnect the EpiFaith CV to the catheter for pressure reconfirmation. Once you've verified that the pressure is correct, you can proceed to insert the guide wire. Confirm the status of auto aspiration. Whenever there is a need for repositioning or uncertainty about whether the auto aspiration has been activated, you can simply press the trigger area again. When the trigger area is pressed, the device will automatically maintain the aspiration function unless the device is fully filled. Effective single-hand device handling. We recommend that users grasp the needle hub directly and press the trigger area using the middle finger. This grip position provides greater stability. Alternatively, you can lightly grasp the anti-slip area on the side of the barrel and use your index finger to press the trigger area. Feel free to find a comfortable grip style that suits your preference, just be sure to avoid exerting excessive pressure on the side of the barrel. EpiFaith CV offers the following advantages. First, this device's compact and lightweight design improves needle advancement stability. Secondly, EpiFaith CV can monitor blood pressure. If the pressure exceeds 30 mm of mercury, the guide wire insertion hole protrudes, reaching its maximum at 50 mm of mercury, alerting the physician to the possibility of the needle tip entering an artery. This significantly reduces the risk of subsequent large-bore artery dilation. Lastly, with the inclusion of a guide wire insertion hole and pressure alert system, EpiFaith offers the safest closed system operation method. By avoiding syringe disconnection before guide wire insertion, it minimizes infection risk and the potential for the needle tip to exit or double puncture the vessel. EpiFaith CV enhances central venous catheterization with its user-friendly design, safety features, and the capacity to streamline procedures while reducing risks. We are confident that EpiFaith CV reflects our dedication to patient safety and procedural excellence.